Welcome to the Career Jitsu Podcast, where we connect the art of Jiu-Jitsu with your career. Our mission is to empower and inspire you with engaging conversations and valuable insights from people just like you who benefit from the shared relationship between your workplace and the art of Jiu-Jitsu, leading you to a more fulfilling and successful life. Frank, this is going to be an amazing podcast today. We have Corey Caracciolo with us today. And Frank, you texted me earlier today, and you mentioned that you thought that this episode was going to be fascinating. And I completely agree with you. To our listeners, this episode is going to be absolutely fascinating because we are going to be talking about like neuroscience stuff, right, along with jiu-jitsu and their connection. So Corey is a physician's assistant in neurosurgery. So he is going to dive right into some great information and great insights for us in how his job connects to jiu-jitsu.
And when I said fascinating, I meant it. What's going to be really fun about this is it's about neurology, and that is going to be mind-blowing. You like that pun?
I love it, Frank.
Always a pun with me. Corey, welcome to the studio. Thanks so much for coming in and sharing your valuable time with us. We're so excited to talk to you and learn more about you. So for our listeners, why don't you just start out, tell us a little bit about what you do as a physician assistant, and then I'll ask you a little bit about your jiu-jitsu experience.
Yeah, thank you. Thank you so much for having me and welcoming me to the podcast. So I am a neurosurgery physician assistant. In short, that means that, I've gone through extensive schooling, graduate from the Mass School of Pharmacy for physician assistants, and then I got a job in neurosurgery right out of school, working at a level 1 trauma center. So that was pretty intense coming right out of school, but loved it right off the bat. And as far as what I do, I would say I treat and diagnose and assist in surgery. So I diagnose patients with neurological issues such as back pain, aneurysms, tumors, neck pain, neuropathy, all these different things. So those are some science words, but in short, I help patients that have neurological problems. So those are the things that I do. I did work with 10 different surgeons before, but now I'm working directly for one. So it's a little bit different in this aspect, but I could go on for days for.
So when people say to you, "Oh my gosh, this isn't brain surgery," you're like, "It doesn't matter if it is because I can do that."
Yeah,
I love it.
Yeah.
There's you got it all, Frank. You got all the puns.
So, okay, so that's what you do. Tell us a little bit about what got you interested in jiu-jitsu, what got you to start it, how long have you been doing it, and what has been your experience?
Yeah, so what got me started was actually one of my friends that comes here. His name's Anthony, and he introduced me to jiu-jitsu probably about 5 years ago. When I first stepped on the mats here at Team Link, he was coming here for a short time and said, should come try this jiu-jitsu. And I had heard about it from years prior. I did martial arts when I was in the military, and that kind of, struck with me. Said,
What martial arts did you do?
so I did the Marine Corps martial arts program, so it's called MCMAP. And they have a belting system very similar to jiu-jitsu. You have different ranks and everything, and I did that for 4 years in the military.
This is why he came in as an animal, right?
Yeah, so I had a little bit of background in that, and because they do use jiu-jitsu techniques, because the practitioner who developed it was a Brazilian Jiu-Jitsu practitioner as well, which, he's actually come to the school before, so it's pretty cool knowing that is one of the mentors that developed our program. But yeah, long story short is that Anthony got me involved, got on the mats, and I haven't turned back from it now in, 5 years. I even got my little kids involved in it and everything because I think it's crucial for us to know how to defend ourselves, and then one to just get a good fitness in there for the kids.
How long has it been now, Corey? How long have you been training?
So about, yeah, roughly over 5 years.
Yeah.
Yeah.
Okay. All
So
right. Yeah. When he first came in, it was, he had done the Marine. He had, like you said, the MCMAP program, the Marine Corps martial arts program. So it was awesome. We had an immediate connection because he, as Corey mentioned, one of the founding fathers of the MCMAP program, was one of our first teachers, one of our first jujitsu teachers. He used to come up, from his base, using like North Carolina sometimes and Virginia sometimes, and he has a daughter that lives here, and he would travel up, and every weekend he would come and share knowledge with us and in jiu-jitsu, and that's how we first actually started doing jiu-jitsu. That was our
That is
foundation of jiu-jitsu.
crazy.
Isn't
What
that
a
crazy?
small world.
yeah,
And it all comes together here, right in the
Yeah,
studio right
yeah,
now.
yeah.
Love it.
And he's somebody that I've known forever. We did karate together when we were kids. Yeah,
That's crazy.
yeah,
Yeah,
yeah.
strange things happen on the
mhm.
show.
Yeah.
So, a quick question. You said the first thing you mentioned was that it was very intense when you went right into the field, right out of school into the field. How do you see that intensity and dealing with that level of intensity? Do you see a parallel between that and jujitsu?
Oh yeah, big time. So that there's definitely a parallel there. You're getting thrown a curveball right off the bat when you're in neurosurgery, especially somebody new to it. And then thinking about it in the mat sense, you're coming on the mats as a white belt, and then you are paired up with, say, even a purple belt or a brown belt right off the bat, and you're like, oh wow, okay, this is different, and you're almost in survival mode. And it's the same thing going with neurosurgery. I would get consults, so that means you get a call from the emergency room saying that you have a patient here with, say, a gunshot wound to the head. We need you to come evaluate them. And, you know, you're basically determining if a patient's brain dead or not. So, you have to do a neurological exam. That's the most rare thing or most intense that you have to, kind of handle, or you're handling either families, it's very distraught, their loved ones are, now very sick. Um, so you're going into those types of thing with a lot of stress and anxiety and things, where you're kind of uncertain. Same thing as a white belt. You're uncertain of the situation you're in. You have a brown belt, sitting on you and mount or something, and how do you get out? you know, you're still doing that in the sense of, the hospital. You're like, okay, I have this situation. How do I get out of it? But you're trying to educate patients, patients' families, things like that. So there's a lot of stress that is going
And
on.
you don't really have the option of tapping out
Correct.
when you're doing
You
that.
have to,
That's somebody's loved one. That's a family. That's
yeah.
that kind of pressure must be
Oh yeah.
intense.
Yeah, yeah.
Yeah.
There is no, in the sense of things here in the mats, you're able to tap out to a point, but you're gonna try to fight as much
Right,
as you
right.
can.
Nobody wants to tap out like every time they're uncomfortable,
Correct.
right? You want to fight
And
that and try to.
what's good about jujitsu is you get used to that feeling, and you're like, okay, I can push a little bit more. And some people in my field don't do well with stress, and they've never been put in situations that are stressful like that. So they kind of tap out, and they say, this field is not for me, and they
So
move
the,
on.
the long-term tap
Yeah,
out.
the mental fortitude that is built through,
Yeah.
through your training. So that's like with jujitsu that helps you, in your job. So do you think that, like, from a physical standpoint, like, do you think that things that you have, knowledge and skills that you've obtained as a physician's assistant, do you think some of that stuff has helped you in jujitsu?
Oh yeah, there's plenty of times when, thinking of my medical background and what I have done and getting on the mats, I'm able to kind of know the ins and outs of the neuroscience part of my body and learning how to shut things off and learning to shut the brain off to know, okay, I can handle this and I can shut this down. I can move here, I can do this. Whereas, some people, even in my field, cannot do that.
I,
Right, not being the spazzy white belt, right,
I
or the spazzy blue.
I almost feel like when I'm hearing you talk about, and I feel like you can like scientifically see what's going on. Like he can see all the nerves and see his brain like
Yeah, like
working.
calculating, almost
Like
like AI, right?
yeah, like
Yeah.
as he's in a position, like
Yeah.
you know.
Well, when you roll with Corey, he's got method. He doesn't spaz. He's always moving smoothly, even from the very beginning. You were never a spazzy like white belt. You were always, you had your method, you tried your techniques. A lot of times they work because you're a really strong guy. And when they didn't, you're just like, okay, let's reboot and go back in.
Yeah. And I mean, in tying it into jujitsu, going into, physician assistant, but neurosurgery is that, you know, on the mats, especially with Jason and yourself, Frank, is that you're learning how to control your breathing and learning how to deal with stress. You're in very awkward positions or you're in very tight positions, somebody's choking you, or you got a nice neon belly on you from Jason, and you're like,
I wouldn't do that to you.
All the time.
you're like, how do I get out of this? And what do I do to get in a better position? It's the same thing, in my field is that, you know, we're taking care of patients and patients' families is that, how do we get them to the next point and help them and kind of guide them into the next segment of this, tragic, incident. It's not all tragic that I'm dealing with, but a lot of it, was before when I was at the trauma center. So you're dealing with a lot of patients and things so that you have to deal with that stress.
It sounds like you're dealing with a lot of stress, and also Jason, I think Jason has said this, but I know I've heard it at the gym that jujitsu is like chess. You need to be thinking one or two moves, three if you can,
Hmm.
three moves ahead. And it sounds like what you're saying is it's kind of like you're trying to do that in an uncertain environment, and sometimes things just don't go your way. Have you found that? Because we have this in jiu-jitsu all the time. We have a plan of action. I'm gonna go for the sweep, and then I'm gonna try to get an armbar, and then I'm gonna try to open the window here, make them reach, go for the sweep, and blah blah. Doesn't always happen the way we want it, right? So you're playing chess, you're
Yeah.
trying to do this. Have you had situations where your whole plan it just implodes and you have to just in that moment deal with that situation?
Oh, yeah. So to think of it, so in surgery itself, so when we're doing surgery in these intricate areas, you have to be thinking about what the next thing is going to be, but also what could happen next potentially. So could it bleed? Could, you hit a nerve, something like that? You have to know obviously the anatomy to a T. Um, but you're thinking ahead the whole time of, could there be a potential uh, bad outcome if I move here or do this? You have to know. So
Kind
you're
of risk
playing,
reward,
yeah,
right?
you're playing that chess game kind of in surgery and knowing, okay, if I just move a centimeter to the left, like I could hit an artery and that could be bleeding now that you're dealing with that you did not expect or want to deal with. So the same thing goes in the mats. You're constantly thinking of, okay, I went for the armbar, but that didn't work. What's next? Like you said, and that's the same thing with surgery, and not just in surgery, but afterwards. Like you're dealing with complications after surgery. What could be the complication? You know, is it a hematoma somewhere? So that's a blood clot that you're dealing with now because we've opened up a cavity. You're dealing with blood flow now that you're trying to heal, but that could be complication, cause pressure somewhere where you don't want it.
It's the whole troubleshooting, which is
Yeah,
what we
yeah,
always.
and like strategic thinking,
Right.
he's in a high stress situation and he has to think strategically. He has to be able to recognize and then predict what could happen and then be able to act, you know. So that, in you're dealing with that in surgery. So for our listeners, I want them to really understand this, that we're talking about Corey being a physician's assistant and being the right hand man for that surgeon. So he is right next to that surgeon as that surgeon is performing surgery, and he has to watch everything that's going on, and he has to be able to be adaptable. So, can you talk a little bit for our listeners, Corey? Like, give them a little visual in terms of like what you're actually doing in surgery. You're near the doctor, and all these things are going on, and how will you adapt?
Yeah. So when I'm in surgery and with a surgeon, so, if we're looking at, say, a brain in surgery, the surgeon obviously is doing the majority of the work, but I'm there assisting in the case, and that could be from I'm cutting skin to opening the incision, the first pass, to holding retractors, things like that, so that he can have good exposure um, to the intricate parts of either the brain or the spine. Um, so I'm holding retraction, but at the same time, I have to know what I'm holding onto because that could be intricate um, parts. So, specifically, say I'm in the cervical neck, we do an approach in the neck where we go from the front, and when we're doing that approach, my retractor that I'm holding is holding the carotid arteries and the esophagus at the same time. So I have to kind of know the level of pressure that I'm using on that because when they have a breathing tube in, then that's their circulation to their brain. I don't want to cut that off or cut their airway off because obviously we know that's
I
bad,
mean, you
especially in
cannot have a bad
jiu-jitsu.
day. You
Uh,
can't have a bad day when you work.
no,
Yeah, we're
I mean,
talking about adaptability. He's talking about holding on to people's carotid arteries in their esophagus and having a something allowing the person to continue to breathe while they're doing surgery. Like that is life and death
that is
situation
life.
right there, and he has to be able to think about what's going on. A lot of things are going on at the same time.
Right. It's a
And
swirling environment, and you need to stay like going through those tunnels at the fun house where everything's swirling. You have to
Mhm.
go straight.
Yeah. So
That's that kind of focus, right?
so to tie that in with jiu-jitsu, getting a good understanding of your airway and your blood flow. So knowing your carotid arteries and your esophagus and your trachea and everything, okay, what could happen if I hold this choke or something too tight, or the capability of what could happen. Um,
I
because
imagine your hand placement
I was
when you're doing the
just going
choke.
to say the same thing. I wonder if
Right
your
there.
hand placement is a little better than everybody else's when you
Yeah.
go for like an Ezekiel
yeah,
or
Yeah, you know how
or
like when
a
yeah,
guillotine,
you
right?
know how when your coach comes over and makes that
Yeah,
little
yeah,
adjustment, like
yeah,
moves your arm
yeah,
like an
yeah. Look,
inch,
yeah,
mhm,
yeah.
and then
There you. Now you're on
just
the
that one
carotid,
inch, and all you're like,
and the
oh,
person's
that
like
made the
tap, tap,
difference.
tap, tap. Yeah,
Yeah, the Corey's like that guy that just goes, no, you just got to tweak it over just a little bit right here. Okay,
that's
got
right. He's
it.
never missing that. It's your favorite segment of the show, Tap In Time, where we tap into your thoughts. So we would like to know, you guys are listening to what we're talking about. Are there any BJJ practitioners out there who are also maybe a physician assistant, a nurse, a surgeon, doctor, somebody in healthcare who operates under high pressure situations? What parallels have you seen between that and your jujitsu? Tap in and let us know.
it's intricate. Knowing the anatomy itself is crucial in my field, but it does tie over into jujitsu. And you've had other nurses and doctors on here that explain that anatomy and length. So I won't go into too much detail there, but any of these fields, you kind of have an up hand on jujitsu, knowing
Mm.
what you can and can't do with certain body parts.
Right, right. Yeah, and in jujitsu, like you said, I'm just going to reiterate this that also the other way, because this whole episode is about being able to make that connection and how both help each other.
Hmm.
So, it's amazing how you can use your medical knowledge to help your jujitsu, and also how you can do the reverse of that and allow your jujitsu to help you with that in high pressure situations, be able to think strategically, and that also builds and breeds and fosters, develops that strategic thinking in both worlds.
That's the magic, and that's why the show exists, right? So I have a question for you. I mean, you're a very confident, intelligent person. Our listeners can hear this, but I'm sure like jujitsu has a steep learning curve, and obviously what you do with the brain, neurology has a very steep learning curve. How have you dealt with, or have you had any to deal with self-doubt in either one of them or both of them? And how has maybe getting through that in one of those, in one of these tracks, helped you in the other?
I would say on a daily, I have self doubt, especially in our field of neurosurgery, um, because of the complexity that we're dealing with. You could be almost 99% certain that you're right, but there's that 1% that you still feel a little self doubt
Mhm.
in your decision that you made. Um, you know, you're dealing with brain cancer, you're dealing with spine cancer as well. And are you making the right decision as far as their treatment plan?
Because people are looking to you. I'm sure you hear a lot. What would you do if this was your kid? What would you do if this was your mother? What would you do if this was your brother? People
Correct.
must ask you that.
Correct.
And then you have to answer that question.
Yeah. So constantly people are asking you, would you do this surgery if it was you? Would you go through with this surgery, if it was your dad or something? And, you have to educate them. There's always a risk versus benefit discussion with these patients. You're guiding them through some of the most intricate times of their life, especially family members too. If you're dealing with cancer is not affecting just one person, it's affecting that whole family.
Right.
Especially when it becomes, if it's primary brain cancer, is one of the uh, most difficult to treat
Mm.
brain cancers. Some cancers have gotten really good treatments, but primary brain cancer itself is still very devastating, and the survival rate is not great if it's primary brain
So,
cancer.
so how do you deal with that voice of doubt?
So yeah, I have to reassure myself, and I talk cases over with obviously my surgeon and other people in my field. You know, I go through that, kind of breaking it down with them. So it's good that I have some people in my field that are near me, that I can kind of relay things that, hey, I did this, and do you think you would have done it? And they give me feedback. It's kind of like that same thing on the mats. You just went through a role with somebody and it didn't really go the way you wanted it. And you might have got tapped out 2 to 3 times, and you thought you were gonna crush it, but
Right.
instead it crushed you. And then you go through it with your training partner and you say, what was going on? What happened? Because there's still self-doubt on the mats. And I even
Always.
think even at the highest level, there's always going to be a little bit of that voice in the back of your head that says, "No, you could have done that a little bit better," or
Right. Or you shouldn't have taken that risk, or don't take any risks, or
correct.
that doubting voice
Yeah.
that you have to deal with.
Yeah, yeah. Uh, so as a clinician, Corey has to, see people before surgery, so pre-surgery. Then he has to also have that person in surgery, and then after the surgery's over, Corey has to then see that person post-surgery, right? So when you see these people post-surgery, Corey, um, and they now have to enter that phase of rehabilitating. Um, I'm sure there must be, I mean, you can, I'm hoping that you can explain for our listeners a little bit about the anatomy behind things but behind rehabilitation of spinal cord or brain and spine and nerve type injuries, because I really feel, I mean, I don't know enough about neurology, but I really feel that jujitsu training really can help that. I really feel like somebody who is rehabbing from something neurological,
Right.
because jujitsu is hands-on, jujitsu is tactile.
Right.
So you have that neuromuscular connection all the time. And so I'm wondering how much of that neuromuscular connection in jujitsu can help in rehabilitating.
Yeah, so
Good question.
yeah, that's pretty depth question, which it's great. As far as after surgery, we are um, guiding them obviously in their next phase of care. And we, a lot of times, depending on what the surgery was for, um, say it was a spinal cord injury, and you've had to now one decompress their spinal cord and maybe put some instrumentation. So that means we've fused their spine to stabilize it. Now their journey begins of rehab and getting them to a functioning standpoint. Obviously, each spinal cord injury is a little bit different, and what level it happens at, and that could go on for days of talking about that. Um, but I think, as far as what I've looked for prior to coming on the podcast, there wasn't a lot of studies pertaining jujitsu as one of the methods, but I think hand in hand it would be beneficial as far as getting somebody on the mat, depending on their function level, because that tactile, uh, hand to hand, especially when you're dealing with somebody that might be dealing with a spinal cord injury. Now you're trying to get their sensory motion or sensory feeling back, but also getting their motor function back, which is key, because your spinal cord is controlling both of those things at the same time, and you're doing both when you're doing jujitsu. You're feeling that training partner. You're moving. You're doing all those things, and
Sensory and motor nerves
yeah,
firing
the
all the
the
time.
synapses of your nerves are firing, and I think rejuvenating that sensory and motor at the same time when you're on the mat. Even if you're laying there and you're just going, foundation wise, doing uh, getting your frames in or something, and you're doing these small, intricate movements, and you're in a pattern where you're kind of doing, those movements of frames, that's going to get your motion back. And especially if you're feeling somebody with pressure and pushing on you, giving you that feedback, that's really when you're going to start feeling that sensory change.
Think about it. So you have jujitsu for the Marines. What was the program called? MEPS?
McMap.
MCMAP. Then you have jujitsu for law enforcement. Then you have geriatric jujitsu, which is what I do.
Mhm.
So think about therapeutic jujitsu. I bet you there's a
Oh
place
my.
for that.
Frank, you just gave our listeners our secret.
The secret sauce. Well, we give value.
That's
We
true.
don't
That's
hold
true.
back,
That's true.
right? So
So, can we just ask him one more question,
yeah,
Frank? I appreciate. I know we are running out of time, but
we are definitely
this is
running out of
just
time. We
this
can really
episode.
talk for like 2 hours here.
We really could. The information that our listeners are getting, Frank, is awesome, and we could literally do this for a long time. But let me get this one more in. So, because I like to talk about a little bit of like multidisciplinary approaches in your profession. So, being a physician's assistant in neurosurgery, you have to like, let's say that person is post surgery and they are starting rehab, right? So you might have to communicate with other professionals that might be handling that person's care, right?
Correct.
So in that multidisciplinary approach, can you talk a little bit about how that works for you, and in how you handle that communication or that collaboration, and how that can maybe relate to how you collaborate with others in the dojo, or on the mats when you're helping training partners. Maybe it's working with somebody who's a new white belt coming in the door, or even somebody your own skill level, and you're drilling a technique, and you go, hey, and troubleshoot with each other, you know so how does that communication help your profession, and how does your profession help that communication?
Yeah. So, um, in our profession, after surgery, like you said, we're going into that rehab phase of care. I have to then communicate to either physical therapist or occupational therapist, or maybe even our neuro-oncology physicians or radiation oncology physicians. So I'm constantly communicating with other professionals to guide the care of these patients, so that when they can rehab or get on to the next phase of their care. So you have to have interpersonal communication skills to be able to do that. And it's important not only for yourself, but you need to be able to do that for your patient,
Mm.
because it can't just stop at you. You need to guide the patient to the next phase. Um, and then going onto the mats, kind of putting that in perspective there, is that, I like honestly working with some of the younger people in our gym, such as, white belts, or even some of the teens that we have here, guiding them, giving them pointers, things like that, because, we're all at that point at some point. And sometimes if I can give advice, give them little tips here and there, even at my level of jujitsu for only 5 years, I like to teach. I like to pass on knowledge, and having that communication skill to pass it on is great, because in the grand scheme of things, you don't want to hold back knowledge. You want to pass it on. If you have it, it doesn't benefit anybody to hold it in. You got to pass the knowledge on to the next generation. Um, that's going back to my field is in neurosurgery. My surgeon, who's got 28 years plus of surgery in his belt, he's passing on his knowledge to myself and then to the other surgeons that are coming up. You know, you have to pass it along. Fortunately, we're only on this planet for so long, and we got people that are coming up before us, and we got to pass it to them.
Yeah.
Well
Well,
said.
I was going to say well said too.
Because brilliant people think alike. That's why.
Yeah. So let's get some takeaways here, Frank.
Yeah, so there's a lot of takeaways here, and I really wish we could extend the show further. So you talked a little bit about intensity, how to deal with intensity, how jujitsu helps you do that, and how your job just feeds you a ton of situations with that kind of pressure. We talked a little bit about survival mode and staying calm in the chaos, right? Staying calm in the chaos, which is what we do on the mats and what you obviously do in your job. Building mental fortitude. These are things that you do at the dojo that are going to translate to any career, especially one that's as intense as yours. Um, I like that you talked about strategic thinking in a way of mapping things out, planning your success route, but also planning what you're going to do when things don't go the way you wanted them to go. I think that's just such a good life skill, not even career skill, but life skill. Uh, you also reminded our listeners that even the people that are doing these amazing jobs have doubts, right? Everybody has doubts. And I like the way you kind of brought in how team collaboration is just so important in facing those doubts. Talk to your team, ask them what they would do in that situation. What advice do you have? What am I not seeing? That's just smart in not only your career, but in any career, right? Troubleshooting, to handle that voice of doubt. And probably my favorite thing that you talked about was sharing your expertise with other people and helping other people out, giving back. Because in life, givers gain. It's good karma, and that definitely happens in the art of jiu-jitsu. There's probably no other activity that you can come in as a beginner and people are excited that you're there. They want to see you stay and they want to help you. They give back. And it's great that you take that and you use that in your career too, and you want to give back in your career. So, I mean, just too many. That was a long wrap up, but you gave us, it was so cogent what you talked about. So many good points.
Yeah.
So we appreciate you.
Yeah, thank you for, and speaking of giving back, Frank, we're giving back to our listeners. So providing our listeners with all of this information, all this valuable insight that we get through our episodes, right?
Yes.
This is no different, right? So we are collaborating together right here,
right,
to be able to deliver to our listeners information that they can use on mats,
and our listeners can give back by sharing this with anybody that you think would enjoy it, because you don't have to do jiu-jitsu to learn all of these great benefits that we're bringing to you from the mats. We put in the sweat and you can just take the benefit.
So like, share, download,
yeah,
share with your friends, spread the word. Career Jiu-Jitsu is
spread the love. Most importantly, spread the love. All right. Thank you so much.
Thank you, Corey.
Thank you. No, thank you again for having me on the podcast.
All right. Be good, everybody.
Well, there you have it. As we wrap up today's episode, let's take a moment to reflect on the powerful connections we've explored between the art of jiu-jitsu and your career. In your workplace and in jiu-jitsu, you learn to adapt and navigate challenges. So remember that persistence and the courage to embrace the lessons that you learn are the keys to your growth both on the mat and in your career.